When the roll is called out, I'll be standing taller to face the darkest and the hardest of times. We'll be taking care of all the children thereof, but if it's required, we'll be on the front.
Greetings, Montserrat. This is Dr. Ingrid Buffonge. I'm hoping that your 2018 is going well so far. I know that circumstances have been challenging for many. I am making this address in particular today because of the damning health system and financing review recently completed for the government of Montserrat, now being called the infamous Mott McDonald report. Many persons have already read it or heard of it. The report is not written from the point of view of progress in healthcare or small island development and sustainability, but rather is a penny-pinching report which will be costly to the public and will not improve the quality of healthcare delivery. The report is about money, how DFID can spend as little as possible in healthcare. The report has suggested very low-budget options. My major concerns are as follows. It recommends fewer district clinics. They have identified that too large a proportion of patients visit the casualty. That's 1,267 per thousand population on Montserrat compared with 374 per thousand population in the UK. It states that only 15% of attendances at Glendon are appropriate, and so these patients need to be routed to the district clinics, yet they plan to close St. Peter's Clinic. The Mott McDonald team recommends that our new hospital really only needs 5 to 12 beds. To be generous, they increased this to 15 beds, and after the ministry complained, they increased it to 20 beds. We presently have 30 beds in our hospital at St. John's. The report does not recognize the importance of local CT scanning. The only CT option which it can imagine is using Belmont's old, inadequate, failing machine, which they have since replaced. It was failing and not adequate for Antigua, but it is somehow thought fit for us. They have also stated that Belmont will be responsible for service provision, so that when the machine breaks down, we simply have to go to Belmont in Antigua. This will just continue the present situation of no on-island CT scanning. The team recommends that all caesarean sections should happen off-island. The only obstetric service locally will be the use of midwives. Midwife-led obstetric services require a doctor, preferably an obstetrician, to be on call when complicated births occur. This has been proven to reduce perinatal mortality. At present, the role is carried out by our general surgeon, who is experienced in caring for obstetric patients. The team who wrote the report has somehow imagined that during a complicated birth, the midwife will have time to take the mother to Antigua. This is impossible and is likely to result in a high death rate for newborns and their mothers rushing for medical evacuation while in the middle of a complicated delivery. In order for planned caesarean sections to take place off-island, pregnant mothers must travel abroad before their due date, often up to 2 weeks before the due date. Who pays for their living expenses for the time abroad before she has the caesarean section and the days after the woman has the baby? And who pays for the medical care abroad? Who pays for their travel? If less and less children are forced to be born off-island, in 30 years' time, who will represent us in Parliament, as you have to be born here to become a member of Parliament? All pediatric surgery will happen off-island, allowing only minor surgery to happen on-island. This is ridiculous and sends a strong message that we are inadequate. We presently have a very competent surgeon who has been performing certain pediatric operations here for years. He performs well during emergencies and knows when to refer. He recently repaired traumatic liver lacerations in a child who was run over by a bus. The child is back at school and doing well. This surgeon has saved lives and has saved us money in performing operations here that the McDonald team would send abroad. This report is an insult to our surgical, anesthetic, and theatre teams. One recommendation by the McDonald team, the one which they have given the highest score to, recommends the medical evacuation of all sick children requiring hospital admission. This would be an unsafe practice and would be extremely costly for patients. One option expects us to have a visiting anaesthetist only, daring to recommend that all surgery, adult and pediatric, happen off-island. The report recognizes a high and increasing prevalence of diabetes and recognizes the number of renal failure patients requiring dialysis will increase, but recommends that the government of Montserrat should have no future plan to run dialysis. So if you don't have access to a lot of money, you won't be able to live on Montserrat or think about coming to Montserrat if you require dialysis. I recall the very sad story of an elderly Montserratian who returned home one year to sort out his financial affairs. He had left because of the volcano. He had been on dialysis in the UK and had plans of traveling to Antigua twice weekly to have dialysis while here. His plans for Antigua did not come through. He died at the Glendon casualty. This failure to commit in any way to future dialysis sends a "don't come here" or "please leave" message to Montserratians with kidney failure, as diabetes and hypertension are both very prevalent in our population and are two of the leading causes for end-stage renal failure requiring dialysis. The report identifies that the health service relies on a small number of clinical staff to provide 24/7 cover, has limited opportunities for staff training and continued professional development, inadequate clinical governance oversight and review, and minimum local access to diagnostic equipment, but it is unable to recommend anything positive to solve these problems. This report makes no commitment whatsoever to the training and continued education needs of Glendon staff. The McDonald team has realized that their recommendations have drastically increased the number of medical evacuation patients, so they want us to hire another team to arrange the medical evacuation of each patient, more paying out of money, and why. I bet a local team will not be hired for this. The report points out that 40% of the population attending Glendon are in the exempt category. The government is paying for insurance cover for some of these persons that it gives free healthcare to. It comes out of their salaries. The insurance company laughs because it has to pay out nothing or next to nothing for local tests at Glendon for the exempt category. In general, Glendon's fees are low because they are very heavily subsidized. In addition, many patients don't or are unable to afford to pay their hospital bills. Thus, when Glendon is looked at from an economic point of view, it is doing badly. So this report is really about money. It's an economic analysis of health, telling DFID how it can make the best savings. It in no way has the best interests of the people of Montserrat at heart, nor does it care about progress in healthcare. The report cannot prove in any way that the options provided represent good healthcare. It is a huge step backwards for health. It will be extremely costly for patients and relatives. There will be increased liability, taking on the dangers of medical evacuation, which offers suboptimal care and a potential for disastrous care situations. For all of this, the report recommends that the government increases taxes. When the Ministry of Health presented this report to the public, responses were very negative. Most felt that the report was fit only for the garbage. Citizens were concerned about the cost to patients and relatives. The cost of health care is very high abroad. Even patients with health insurance have to pay a health care bill, and then the insurance company pays a certain percentage, often small. Some citizens were concerned about the low morale this sort of substandard health service would create, the message it sends to our Montserratians overseas, to visitors, to investors. One citizen brought up the question of mass casualty situations, the potential for very poor healthcare delivery with inadequate beds. An economist in the audience lamented that the people on Montserrat will be sending their money to Antigua, helping Antigua's economy instead of our own. One person who commented spoke about social costs involved that were a barrier to access to healthcare for many persons, and that these were discriminatory and racist. The recommendations, she thought, warranted a social impact assessment to see the effect that they would have on people. And that person also mentioned that it's a legal requirement to be Gender Equality Act compliant, that it must not have a heavier impact on women. The recommendations in this report create a huge burden for women, inadequate care locally for themselves and their children. The date on the report is the 3rd of November 2017. It is a shame that the report didn't go directly onto the Guy Fawkes bonfire on the 5th, because this report attempts to assassinate all progress in healthcare and the development of our island. It is not only an insult to the people of this island, but it will create financial hardship for patients and relatives on Montserrat. It will halt the development that this island desires, making us appear to be something out of the dark ages that no one wants to migrate to. It is likely to encourage migration in the opposite direction, migration out of Montserrat. We need a new hospital. Don't wrap us up with this cheap rubbish deal, signing away our island's future, signing away the survival of our people. Do not encourage this attempt at genocide. The Honourable Minister of Health has until January 25th to accept this report and to choose one of its ridiculous options. Please join us in ensuring that she does not agree to this document. Please contact your health minister and let her know that this report does not have your best interests at heart.
Are you ready? 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 Are you ready?